The ultimate test for this budget was for the Albanese Labor government to build on the strong position it inherited from the coalition to address cost of living crisis bearing down on Australians. It's clear Labor has failed its first test. During the election, they bribed Australians with promises of wage rises and being better off under an Albanese government. But in reality, Australian families will be $2,000 worse off by Christmas. Power prices are going up, interest rates are going up, taxes are going up, and unemployment's going up, and real wages are forecast to go down. The only cost of living relief they've provided in the health portfolio is their $12.50 reduction to the PBS general co-payment, which was a copycat announcement of the coalition in the election. And this measure doesn't kick in until next year. In fact, there does not appear to be any immediate cost of living relief provided in the entire budget. Instead, they have an aspirational goal to build 1 million more houses while providing funding for only 10,000. For those in South Australia who know how health has been such a significant issue, it's also really concerning that Mr Albanese has completely disregarded the health needs of Australians by cutting hospital funding by nearly $2.4 billion. One of the other largest measures in the health portfolio is the $235 million provided to establish 50 urgent care clinics across the country, including one here in South Australia in the Boothby electorate. Yet we've known from the outset that this policy announcement was purely political and one that will actually have a significant impact on the pressures facing our health system. And once the sugar hit of this one-off funding is spent, it will be left to the states to pick up the tab. We also know that the aged care sector is crying out for staff, particularly in rural and regional Australia, as they prepare for Labor's 24/7 registered nurses requirement to commence. Yet the Albanese government has not announced any immediate aged care support to boost the workforce numbers of registered nurses. And when you look at their entire $2.5 billion aged care commitment line by line, it's lacking in any detail and are not a cent to pay for the rise they promised aged care workers. This is a big spending, high taxing budget. It's a budget for the unions, not a budget for you.